one look at this ECG will tell you that this is a tachycardia ECG. But before that, we will have a look at the standardization pulse. In the earlier ECGs, the standardization pulse was not easily seen. So here you have a very good standardization pulse, 10 millimeter to a millivolt. A nice square wave is seen here. Now we'll go into the tachycardia part of it. We'll calculate the heart rate. RR interval is 10 millimeter. So 1500 divided by 10, we'll get heart rate as 150 per minute. We know that tachycardia is heart rate above 100 per minute in an adult. Below 60 per minute, it is bradycardia. Normal individuals can have tachycardia in exercise, anxiety, and fever. Similarly, they can have sinus bradycardia during deep sleep. There are other conditions also which can cause this, but we will not go into those details. Another interesting thing here is this line here. What is this meaning of this line? Usually this would indicate that the ECG paper in the machine, loaded in the machine, is nearing its end and would need replacement. Otherwise there is no reason for this line to appear. It is not part of the ECG recording. There is a simpler and quicker way of calculating the approximate heart rate. You take the number of large squares between two R waves. There are two large squares. Divide 300 by that. You get approximate heart rate as 150. This is a method we usually adopt when you see an ECG to get an idea of the approximate heart rate. So this is a tachycardia. I would say that this is a narrow QRS tachycardia because the QRS is not that wide, and a common form of narrow QRS tachycardia will be AVNRT, that is atrioventricular nodal reentrant tachycardia. It is due to a reentrant circuit in the AV node, downward and upward. The downward circuit will continue upward so that the rate becomes very fast. And when this occurs, signals will go down into the ventricle producing the QRS and up into the atria producing a retrograde P wave. There is no regular P wave seen here before the QRS. For a sinus rhythm, you expect P waves, especially in the inferior leads 2, 3 and AVF. An upright P wave will be seen because the impulses are conducted from the upper part of the atrium known as the sinus node down to the AV junction and then to the ventricles. So when atria are activated from above downwards, you get a P wave which is upright in inferior leads because inferior leads are facing towards the lower part. Here regular P wave is not there before the QRS, but there is something here. Terminal portion of the QRS is sharp. This is most likely a retrograde P wave. It's seen in 2, 3 and AVF. They are also called as pseudo S because it appears like a short S wave. That's why sometimes you may think that the QRS is slightly wide and not narrow. And the opposite of this you see in V1. This is a pseudo R wave. It is a retrograde P wave occurring at the end of the QRS. When the conduction is from the lower part of the AV node upward into the atrium, QRS occurs first and then the P wave atrial activation occurs second. That is what we are seeing here. So this is most likely an AV and RT, but the differential diagnosis is AVRT. Atrioventricular reentrant tachycardia in WPW syndrome. Note that in WPW syndrome, delta wave of pre-excitation and short PR interval will not be seen during the narrow QRS tachycardia because downward conduction is through the AV nodal pathway and into the normal conduction system. So the most common type of AVRT is orthodromic conduction through the AV conduction system and the ventricular bundle branches. So QRS is narrow. Only if you take an ECG after converting this tachycardia will you be able to see the slurred delta wave, and then there will be a P with a short PR interval. And of course there will be ST depression and T inversion, that is opposite to the QRS direction. Here we are seeing ST depression and T inversion. We will discuss that also. When the ECG is in a young individual, it is very unlikely to be due to associated ischemia. But in an older person, ischemia should be ruled out later on, even though similar changes can occur even without ischemia. In this ECG, there is another feature, that is deep S waves in V1 and tall R waves in lateral leads. So there is some underlying left ventricular hypertrophy also, which could have contributed to this pattern. So all these aspects you should consider. And still another aspect is that when the rate is exactly 150, we have to think of atrial flutter. Atrial flutter at a rate of 300 per minute. The typical atrial rate of atrial flutter is 300 per minute, and half of it may be blocked at the AV node. So you will get 2:1 AV conduction and the ventricular rate will be 150 per minute. So whenever an ventricular rate of 150 is seen, always rule out atrial flutter with 2:1 conduction. You have to look carefully for flutter waves between the QRS complexes, but definite flutter waves are not seen here. But it may not be very easy. Sometimes flutter waves may be masked by QRS complex or T waves. So you could also try giving a careful carotid sinus massage to slow the ventricular rate and see if flutter waves are appearing in between. During termination of this tachycardia with adenosine also, initially if the flutter waves are there, they may appear more prominently, because when the heart rate slows down, flutter waves can be seen easily. There is another aspect to be thought of when the ventricular rate is exactly 150 per minute. That is atrial flutter with 300 ventricular atrial rate and 2:1 AV conduction. A precaution during carotid sinus massage, everyone will know that it can displace a plaque in the carotid artery. So it's just compression and not a true massage, and should not be done bilaterally. And you should auscultate for bruit of the carotids before doing that. And if there is a history of stroke, you would not probably do it. There is a risk of cerebral ischemia while giving a carotid sinus massage. Then the person should be under monitor, and in case of severe bradycardia, you should be able to immediately treat it as well. So in a monitored intensive care like setting, that is a cautious carotid sinus massage. These are the important aspects in this ECG.